Zambia has successfully hosted the 75th WHO Regional Committee for Africa in Zambia. Ministers and technical teams from 47 countries met, set priorities, and look decisions that guide health policy across the continent. What does this body do? It is the top forum for Africa's health policy. Countries review progress, adopt strategies, and align funding and partners. The outcomes shape what gets financed, built, and delivered in clinics and communities.
A more effective and efficient WHO in supporting country-level work. I think Dr. Tedros, Dr. Kaser, and others who have spoken have already articulated this issue. I'm driving them that it needs. I know comments have been made about Zambia's national health achievements. Thank you for recognizing these achievements. But where we sit, where I sit, where our government and the people of Zambia sit, we are too far behind, despite the improvements we've made. We're still too far behind. A lot ought to be done.
What this means for Zambia hosting signals, trust. Zambia can plan, convene, and deliver at scale. That strengthens our case for future investments in health, research, and manufacturing.
Drain of resources requires good governance, strong public accountability, and bold leadership. In May, the World Health Assembly adopted a landmark resolution led by Nigeria and co-sponsored by over 25 countries, including Ghana, South Africa, Senegal, and Zambia, calling for more domestic investment in health and deeper governance reform. It reflects the Lusaka agenda and the principles of one plan, one budget, one report. WHO is committed to supporting all member states around the world and here in Africa to build strong, resilient, inclusive health systems guided by evidence and grounded in equity.
Equitable access to medicines and vaccines. President Hakainde Hichilema used the platform to push a simple goal: make essential medicines and new technologies available to every African who needs them. Partners backed this with a $1.2 billion United States dollars African Manufacturing Accelerator Fund. The task is clear: move from importing to making, transfer skills, build local plants, strengthen regulators, keep supply chains on the continent. Why this matters? Africa produces about 1% of its vaccines. COVID-19 exposed the risk. When borders close, shelves go empty. Local manufacturing fixes that. It keeps the stock flowing to clinics. It creates skills jobs. It cuts foreign exchange pressure. As global and African Union champion for cholera, the president launched the Continental Cholera Response Plan in Lusaka. Right here in Lusaka, he called on heads of state to set up presidential task forces. The focus is practical: target hotspots, expand safe water and sanitation, pre-position vaccines and supplies, coordinate across borders, track results every month. Direct gains from the economy. A meeting of this size fuels planes and hotels. It puts money in the hands of workers in hospitality, transport, catering, cleaning, and security. It showcases our airports, conference venues, and city services. It strengthens the case for more conferences and medical congresses. That is steady business for airlines, tour operators, and hotels. Why Zambia is well placed? Now reform in visas, aviation safety and trade facilitation made entry simpler and travel safer. Health investments improved cold chain, disease surveillance, and emergency operations. The country is pitching for health manufacturing and clinical trials. Hosting shows the system works under pressure. What changes on the ground? More reliable supply of vaccines and essential drugs as partners shift orders to local manufacturers. Stronger Zambia Medicines Regulatory Authority to approve products faster and keep standards high. Of course, high. Expanded cold chain and oxygen capacity in referral hospitals and districts. Better early warning systems that link climate data with disease alerts. Faster cross-border response with neighbors on cholera and other outbreaks. What to expect in the next 12 months? a national plan to localize production of selected health products with clear timelines, skills programs with universities and training colleges tied to plant needs, new financing windows for working capital and equipment for medical manufacturers, performance dashboards on cholera hotspots and WASH projects published regularly, follow-up Africa-wide meetings in Lusaka on supply chains and regulatory harmonization. Why this matters in a time of frequent crisis, drought, floods, and outbreaks now hit more often. Countries that plan, produce, and coordinate bounce back faster. Now, hosting this meeting places Zambia in that group. It lifts our health security. It attracts partners who bring capital, technology, and markets. It creates jobs and builds skills that stay right here. Bottom line, Zambia did more than the host. We set the tone on the access to medicines, vaccines, manufacturing, and cholera control.